Okay, well, good morning, and thanks for joining us at the Block Breakfast Club today. This is the second in a series of webinars we're holding about networking in healthcare, and today we're talking about securing the healthcare network. I'm joined by Paul. So, Paul, would you like to introduce yourself?
Morning, everyone. I'm Paul Yarwood. I'm one of the network architects at Block. I'm really happy to be here talking to you today. We're going to focus mainly on campus network security today, but obviously this will have sort of wider implications for other areas of the network as well.
Okay, fantastic. So we can move on to the agenda. So we'll have a bit of a fireside chat about networking and security and the outcomes we need in healthcare, and just the approach to build the security, the components, how to go from perhaps where you are today to a more secure network, and some of the considerations that you might want to just take on board during the webinar in your approach to network security. There is a Q&A session at the end, but please, if you want to put questions in the chat as we go through, feel free, and we'll see if we can answer them as we go along.
Sure. Excellent. So, Matt, we talk to customers all the time around the networks, the challenges that they face and the outcomes that they need to achieve. Up on screen, we've got some of the most common responses that we get from customers. Obviously, you're an experienced leader in IT healthcare. Can you just give us a bit of a flavour of your thoughts as to what network security means to you?
Flattery will get your own way. Thanks very much. Yes, so for those of you that don't know, I've joined Block probably about 4 months ago. 4 months ago today, I think, actually. And for over 9 years, I was a CTO in a large health board in Wales. So in my experience, security was really, really challenging. The network is massive. There's many tens of thousands of devices connected to the network. And there's a lot of stuff that you know about. You've got the managed estate, your laptops, your equipment, your desktops, all the things that are kind of in your control. But there's been a huge explosion in sort of IoT space, the medical devices space, the connected building management systems, the nurse call systems, all this stuff that's joining the network that was really becoming a real concern for me. And just understanding and managing those devices and making sure that we were protected against those devices, and that the network and the services were protected was really worrying. I think the managed devices were difficult just due to the scale. For me, we're talking about something like 16,000 laptops and desktops, quite a lot of bits of kit to get up to date, patched, and make sure they're not vulnerable to any sort of threats or CVEs. But the IoT stuff was just a whole other level. I think that was really one of the areas where we had a lot of concern. The team did really well in terms of understanding what the threats were, but it was quite a hill to climb, to be fair. And I know I'm not alone in thinking that. From my time in the NHS, while I worked with the peer support network and the colleagues, that those kind of issues were not just experienced by me; they were experienced by others as well. The health board needs to have visibility of what's on the network. It needs to understand what the threat is, and needs to understand what it needs to do about it. And you've got to evidence that really, just from an assurance perspective, a cybersecurity posture perspective. So, it's a big area of concern for me, and a big area that was very important to be able to show, that we're moving towards compliance for. And there's lots of regulations like GDPR and NIST and lots of other stuff that we might want to think about, cyber assessment frameworks, where we need to just sort of rein that in and get that under control.
Yeah, wow, this is a daunting set of challenges, isn't it, really? It's quite interesting that a lot of the challenges that you talk to there, they're kind of symptoms of the network security models we operate today. So if we think about how our networks are typically architected today, we generally operate on what we would call sort of implicit trust model. And what I mean by that is customers will have different zones or security zones within the network. So if we think about the on-premise network to begin with, within that major zone, we will have typically a campus zone. We may have a DC zone, we will have a branch zone as well. And generally speaking, the majority of security controls are at those zone boundaries. Obviously, that gives us a bit of a challenge, because if you think about what happens within a zone, obviously that zone being a campus, there's potentially thousands of devices in there that are all talking. And it's kind of like, if you imagine it like going into through a swipe card door in a hospital environment, you swipe through into the department, you get through into the corridor, all of a sudden you can pretty much roam freely within that until you come to the next security boundary.
Yeah.
Obviously, that leads to a lot of the challenges that you were talking about before, with the lack of visibility and probably more importantly, a lack of control, because we can't control what we can't see, and obviously we can't be aware of our risks in that scenario. So realistically, we need to have a think about how we address the kind of outcomes that we need to face. And obviously the landscape's changing. You mentioned regulatory compliance. Obviously that's getting stiffer all the time. That's only ever going to get worse. The threat landscape that we face is getting harder as well. If we think back to, you know, some fairly unique attacks like the SolarWinds event last year, that was kind of unprecedented in the level of complexity and compromise that caused across the world. So obviously that means that we have to acknowledge that the implicit trust model that we operate today doesn't really fit for the future, in my opinion.
Yeah, so, you know, dreadful analogy, but, you know, me full of those. You've got a bouncer at the door of the nightclub, but once you're in, you can wander around and do whatever you like. You know? And yeah, that, you know, it's a simple way of thinking about it. I do like the hospital swipe card analogy. You know, once you're in the room or once you're in the corridor or the site, you can just go around and start doing what you want, really. Which, yeah, you know, I think nowadays we need to be more concerned about protection and security, don't we?
Yeah, absolutely. And really, in my opinion, we need to start to shift our thinking towards new types of security models. And particularly today, we'd like to talk about zero trust security models.
So, you know, zero trust, yeah, to me, it sort of feels a bit like a buzzword. I kind of get it, you know, I think I understand broadly what it is, but it's something I hear a lot of vendors talking about. What's it really all about?
Well, I think first and foremost, it's important to understand that there's a difference between a zero trust security model, which is a principle, and a zero trust network architecture, which is essentially the implementation. So if we ignore products and vendors for a moment, what we're really trying to do with zero trust is reduce the size of those security zones. So what we want to do is move our enforcement controls right down close to the endpoint. In network terminology, we're trying to get right to the endpoint or the user or the application or service that we're trying to protect. And obviously what that does is brings the ability to control it much more granularly. So if we go back to the hospital corridor analogy, all of a sudden every door is locked. You can't go into any room without being explicitly permitted through your swipe card. The other piece that happens when we move to a zero trust model is we're taking away implicit trust from the system. So what we're saying there is, well, okay, we know that Matt Mahoney's gone through this door. We know that Matt Mahoney's gone through another door into, say, maternity. We then also say that
I've been in the hotel a couple of days, and I bet the bill waits on for.
But we can have a sensible thought in that scenario is, well, why has Matt Mahoney gone into maternity? Does have any business
I see where you're going.
Exactly. So may well be an trusted employee, but if you're behaving in a way that you shouldn't be, we need to remove that level of implicit trust effectively. And the way we do that is through additional context in the controls that we apply. So what we're trying to get to, as I said before, is, you know, who is Matt Mahoney? What is he doing? Where is he? When is he there? Why is he there? And how is he doing what he's doing? And what we're trying to do through that is fully understand the communication flow between devices on the network.
So it's like controlled access between devices, but also you said time as well. So, you know, if you're behaving in a particular way on the network at a particular time, if that's not expected, then that will be stopped as well.
It potentially could be, obviously, it depends on whether that was a concern or not. But if you were doing something outside of normal working hours, that potentially flags up something that shouldn't be happening.
Okay, so, you know, it's a big shift in thinking, isn't it? I think, you know, it's I get it, I suppose, you know, explained clearly and simply. I suppose then how the heck will I implement that in a large network? It sounds like a real sort of shift in mindset. Is it something that's easy to achieve? Is it difficult? How do we get there?
Yeah, so I mean, it's definitely a change in mindset, and frankly, I can see how it looks daunting. Really, when we start to consider risk and patient safety particularly, it starts to become clear that change in mindset is definitely necessary. And obviously, like I said before, there's a difference between a zero trust security model and a zero trust network architecture. So what we really want to do first and foremost is make the decision that we're going to move towards that zero trust security model. That's kind of step one.
Yeah.
And really then we move on to building our zero trust network architecture. And we can do that incrementally. It's not one massive thing that we have to do overnight. We can build that up by essentially building the building blocks as we move along.
Yeah, so it's a principle, isn't it? You know, so we've got steps towards zero trust rather than it's a switch that we turn on overnight. Okay. So how do we do it, Paul?
So if we move on, essentially what we're showing you here is a four-step process, really, which is trying to build in the key building blocks that will be part of the zero trust network architecture. And what we really want to do with this is build a layered approach to having different security controls that all work in harmony. And the key bit really is we're trying to provide preventative protection in the first place and the ability to respond. So typically what we say to customers is start with network access control. And in that zero trust security model, that provides us with the identity, so the who, and typically speaking, the what of what you're trying to do. Obviously, we can build different controls into it and we can gain different benefits at different times. So once we've introduced network access control across the wired, the wireless, and potentially the remote access VPN as well,
right,
we gain complete control over the devices that can connect to the network. What we also typically gain is about 90% of the endpoints on the network are easily identifiable. The remaining 10% tend to be the more esoteric IoT devices that are a little more challenging to figure out what it's for. But really the benefit we get at that phase is we start to understand the risk profile of the network. So just to give an example from a customer we've worked with in the past, we have a scenario where we've deployed .1x across the entire environment, and we come to a point where we've suddenly identified that even though the customer wasn't aware of it, there's a shadow estate of hundreds of different unmanaged Windows endpoints out there.
Right.
And when we look into what those are actually for, they're typically speaking provided by medical suppliers.
Yeah.
So, you buy a hematology analyzer, they give you a PC with some control software on it. That's connected to the network. Nobody knows it's there. Nobody's patching it. It's got no AV on it, but it's still on the network. So again, if you think about this in sort of risk management terms, as we talked about before, just having that initial phase, we can start to take that risk profile down, or at the very least know the risk is there so that we can start to address it.
Okay.
What we typically then recommend to customers is to move into the segmentation phase. Now, segmentation takes two major forms. So what we're really trying to do with segmentation is reduce the internal attack surface. What I mean by that is moving those controls right back down to the edge.
So that's the swipe card. No one can get you into the hospital and get you into the rooms you need to go into.
Yes, exactly. So we can do that in two forms. The first form is called macro segmentation, and that's a bit like the large security zones that we talked about earlier on. We can typically use that to break up different use cases. So if you think ICS, multi-tenancy is a very common one that we need to start to accommodate. We can use macro segmentation to achieve that. It's also quite useful as a function where we can install security boundaries between different things. So if you imagine like IoT devices, for example, we might wish to enforce that goes through an inspection engine, such as a next-gen firewall or something like that.
Okay, yeah.
So once we've implemented that, obviously, like we say, we're trying to reduce the attack surface, but what we also gain through that is cyber resilience, because obviously, I think most of the people on the webinar will remember way back as far as WannaCry, 5-ish years ago now. The way that spread through the network, the problems that caused people was horrendous. Now, obviously, we've got controls out there. MDE is pretty much ubiquitous now. But that only covers a fraction of your estate. If you think about it, your desktops and your laptops, they're probably 50-60% of your estate if you're lucky. You're going to have countless numbers of unmanaged embedded Windows devices out there. So having that ability to reduce the attack surface, you innately stop propagation of threats throughout the environment. Yeah. Which, as the slide says, that just increases your resilience in the event that a significant threat.
So even if there is, an attack and an outbreak, it's contained to the domain or the segmented area of the network, so you're not necessarily hitting the data center, you're not impacting services. Obviously, this is all down to whatever your design looks like, but you are controlling
exactly
propagation.
In a zero trust scenario, even with within a VLAN in sort of historical terms. If we've got PCA and PCB, if they can't talk to each other, that malware can't propagate.
Oh yeah, that's okay. Great.
So when we've got our segmentation in place, what we typically move on to next is what we would term contextual access. So what we mean by contextual access is we start to bring together other security components. So typically speaking, the other controls that we would bring in at this stage will be things like endpoint posture assessment. We'll integrate it with things like network detection and response tools, potentially vulnerability scanners, or IoT-specific security controls that we may have in the network. Obviously, that's not an exhaustive list, but there are others. And really what we're trying to do at that phase is bring in that extra information that we need to enforce our zero trust security rules. So what those really do is give us that extra context. And what that allows us to do is make the network risk aware and make it act as an honest broker.
So what do we mean by endpoint posture?
So it can mean different things. So if we were to think of a very simple example would be, we know our security policy says that our laptops should all have MDE installed. They might also have something like Sophos AV on top of that.
Right.
Should be BitLocker encrypted, all our phones should be registered to our MDM, etc., etc.
Windows 10, 11, not Windows XP.
Exactly, yeah.
That kind of thing, okay.
Yeah. So what we're really trying to do is validate that the endpoint is compliant with the policies that we have. And obviously it's all part of that removing the implicit trust. It's no longer enough to say, we know that this is one of our laptops and it's not been stolen. We want to know if it's behaving in a way that it shouldn't be. And then really, we move on from there to the full sort of zero trust security model. And what we're trying to do at this point is essentially move to an allow-less model of networking. So essentially IT and the cyber teams have complete control over the communications that we permit upon the network. By default, everything is denied. And all of the connections that we do permit, we subject to that sort of sixth stage of what is it supposed to do. And we inspect it to proper scanning, either at the network or the application layer as appropriate. Okay,
so there's quite a lot of different technologies, as you sort of described. Really, it's zero trust is not a thing; it's a collection of tools and an approach to network security. I'm just looking at particularly sort of the first couple of steps on that journey. I mean, how likely is it that people are running any state that's capable of this approach?
So. It will vary from customer to customer inevitably. There's no one-size-fits-all answer, but the reality is most customers will have at least some of the components they would need to do this.
Right. So
if you think network access control, most customers will have a NAC appliance of some description. Cisco ICE is pretty ubiquitous. We see occasionally Extreme and various other forms of NAC out there. Generally speaking, it will be covering the wireless. In a small number of cases, we do see some customers that have it on the wired network and potentially the remote access VPN as well. Typically speaking, most customers will be running switches that can support at least basic .1x. Obviously, the age of the equipment does somewhat limit what you can do if it's not modern equipment. But most customers nowadays,
it's been around a while, isn't it? Like the Catalyst series, 9300s or 9200s, I think. They've been out for a good few years now, haven't they? So
exactly, and going back even to 3850s and that kind of generation.
Really? Okay.
The vast majority of it, not all, but the majority.
Fantastic. So, how, if you want to get zero trust, how do you get there? What's the approach to it? And how feasible is it to sort of strengthen the security of the network? And what does the journey look like, I suppose, really?
Yeah. So, if we talk quickly through the components that we have in the network, so we spoke briefly a moment ago about NAC and other components there. So. Really, fundamentally, we need a wired and wireless network. All customers will have one of those. That ultimately is our policy enforcement point, and that includes, obviously, the other aspects of the network, like firewalling and so forth. On top of that, we need to build a policy decision platform. So I mentioned Cisco ICE before. That's typically the most common one that we see out there. Obviously, other vendors are available.
Yeah.
On top of that, we need, ideally, an orchestration layer. So if you think about the number of switches and devices that are out there, trying to enforce our policies sort of incrementally box by box, it doesn't really work.
You've got 800, 900 switches on a healthcare network. You want to have a way of doing that.
Precisely. So, an orchestration is key, whether that's a vendor supplied solution like Cisco DNA Center, or whether that's something like Chef, Puppet, or Ansible that you built yourself. It doesn't really matter, to be honest. But ideally, you need that orchestration layer to do this. So on top of that, again, you need your overlay security tools. Most customers will have something in place at the moment and may well want to build on that as time goes by. So, that may mean at the moment you've got something like a network detection and response tool, or you are interested in doing posture or whatever it may be. You can build those tools in bit by bit as time goes on. Now, really the key bit, and this is the bit a lot of customers overlook, is your endpoint management and your identity infrastructure. Obviously, as we move towards that zero trust security model, it's increasingly important that we know who everybody is, what everybody is. If your your Active Directory or your PKI infrastructure is not working properly or is not up to snuff, you are going to struggle on that zero trust journey.
So, I think fundamentally there really is, you can go to a hell of a lot of effort to get a zero trust working, but if you're not controlling your directory and who's got access to the network effectively, it's a fallacy, really, isn't it?
It's a problem, yeah. If you think about it from the point of view of, well, you can provision access, well, that's great. It's how do you deprovision access? If you can't do that, you've got problems. So
joins, moves and leaves, all that sort of stuff, and the use of administrative accounts and privileges, you've got to be on top of that for this to work effectively, really.
Ideally, yes. Same with endpoint management. It's all well and good saying that we're going to remove implicit trust from the network. If we're not actually managing our endpoints, it's virtually impossible to do that, right?
Sure. Okay, so we go back to what we were talking about before. Do we need a brand new network then, or are we going to all have to move to software-defined networking and identity service extension, or is this something we can do even without that capability?
Yeah, so I've been very deliberate in not talking about software-defined networking at the moment, because the reality is that you don't necessarily have to do SDN to do this. You don't have to buy a solution like Cisco SD Access. The reality is it's dramatically easier to do it with a software-defined network. Just because they're designed from the ground up for this kind of capability. There's no good reason why you wouldn't go to a software-defined network. You get that centralized management and orchestration. You get the security controls built into it. The communications protocols are designed with this kind of capability in mind. But yeah, if you have an existing network, really it's just a judgment call on the age of your equipment, the licensing you've got, and really whether you can, implement all the features that you want with that equipment. A lot of customers can go part of the way along the journey. It may be that you could start doing network access control, for example. You can maybe start to integrate some of your overlay tools and then, build it into your business case for when you come to refresh that you want to adopt this kind of technology.
Yeah, so in my experience, you never refresh the whole health board in one go. You're doing it in a constant cycle of refresh, and you can tactically move to capabilities as you're going through that life cycle of your organisation, and you can broaden and expand the reach of that security model as you're going through the infrastructure on refresh cycle. Okay, that's really good. So, in the organisation I worked in, we had implemented NAC and segmentation, a new build site, which did have challenges. The implementation, I can see, had a lot of benefits, particularly in terms of automation and deployment, but also just having that confidence and security on the network. But as I said, that was a new build site. It wasn't going to affect hospital operations if we got anything wrong, but we did need to then think about how would we implement this at other sites where we had we talked about the underlying, kind of like hardware and capabilities, but we need to roll out segmentation and network access control at a live operational hospital. And that, I'm not there anymore, but that was one of my real concerns in terms of the approach and how we do that. So is that something we can maybe talk about?
Yeah, absolutely. So, you raise a good point. It's something that every customer asks us around. Realistically, there is some risk involved whenever you implement new controls in a brownfield environment. What we really try and do to manage that is just follow a straightforward 5-stage program plan. I think everybody on the call will recognise that as a fairly straightforward program plan. Really, the key bits up front are try and define what our target state wants to be. So, are we trying to go all the way to that stage 4 straight away? Are we perhaps happy to go to stage 3 to begin with, or stage 2, or what's appropriate for us in our risk position? Realistically, we also need to factor in there, do we need to refresh infrastructure, etc. All of that needs to be considered. And then we, roll through a fairly straightforward project plan of the pilot deployment, and then just follow it up with the rollout of the actual technologies before we transition it into BAU.
So what sort of challenges can we face with that? What's going to get in the way of us succeeding?
So one of the most interesting challenges that we face, and you kind of touched on it a minute ago when you were talking about the greenfield deployment, is the devices rocking up out of nowhere. And it's one of the key problems is obviously procurement's decentralised in most organisations. So individual departments have the buying power to go out and buy this equipment, and we've all been there. IT, the last to know. The first you hear of this device rocking up is somebody ringing the help desk and saying this network port's not working.
Why isn't my thingy working?
Exactly. So really, that it's a bit of a challenge. Obviously, that it's a challenge I think everyone's familiar with. But really, the way to fix those kind of challenges is to embed it and to get that stakeholder engagement in up front.
Yeah.
Technical challenges, of course, you're going to come across the odd device that you can't figure out what it is. That you just have to manage that through over time. But really, if you consider the risk management approach, what you're trying to do is identify and reduce risk. So it's perfectly acceptable to have a device that nobody knows what it is, as long as it's captured as a risk and there's actions going on to try to identify that device over time.
Okay, so I suppose what I'm really into that is that in some respects, like my experience of a greenfield site where we had engineers from nurse call companies, building management companies sort of turning up and trying to get on the network. In some respects, that could be more challenging because they are complete unknowns at that point.
Exactly.
Whereas when you've got a brownfield site, you kind of know what's there and you can learn about it and take action. As you said, manage the risk as you go through to determine how close to that zero trust model you get. So, what approach would you take? We've talked about segmentation, we've talked about NAC, we've talked about posture. What would you do first?
So, if we look through, typically, like we said on the slide before, what we go through first is your NAC deployment. Now, you're going to see fairly quickly that the approach that you take to all of these different controls is not dissimilar. So, I think that's one of the things that we see quite a lot is customers get a little nervy, shall we say, because it seems like this sort of black box of magic and it just seems impossible to do. But really, what we go through is a simple two-stage deployment and then transition into BAU. So in monitor mode, really what we're trying to do is deploy the configurations to the endpoints. So we're getting the PCs to authenticate to the network. We're configuring all the devices with whatever credentials we're going to use for them. We're rolling that out stack by stack around the network. And we're doing the sort of profiling and classification, and it's really at that phase where we start to get that visibility into what's out there. Once we've done that, we move on to enforcement mode, and again, that's enabled stack by stack, so we've got an ability to control the risk profile of doing that. We can enable it very granularly across the estate. And once we've done that, that's the point where we've now got 100% control over what's connected into the network. Obviously, BAU can't ever be overlooked. The consumption model of the network does change with this kind of technology. So we do have to factor in, new solution onboarding, requirements changes. And as I said before, what we really want to do is get it embedded into our procurement processes so that we know about these devices before they land.
So you're learning what's on the network by just sensing the traffic and understanding it. Monitoring. Once you've got yourself to a position where you've made some sense out of that information, come up with a strategy, a policy, you can start enforcing. And kind of back to the point I was making about the greenfield experience, where you've got building management system engineers turning up, you've got nurse call engineers turning up, you've got perhaps radiology devices turning up. Actually, you need to get into that BAU space where you're working with facilities or the kind of teams that are procuring network connected devices to make sure that, as we said earlier on, really, that people aren't turning up on Monday morning and saying, I've plugged in my radiology ultrasound scanner and it ain't working, and it's all your fault.
Yeah.
You need to just get in there a bit earlier. I know, I'm sure many of the IT people on the call will probably experience that and know the importance of getting in up front with the healthcare organisation, just to make sure that you're in the supply chain and that your equipment's secure and you can profile it and bring that onto the network safely and securely.
Absolutely.
So what's next?
So next up, we go through segmentation.
Have you changed the slide?
I have changed the slide. So again, we don't need to spend too long on this. The deployment model is the same as it is for NAC. Really, we go through a monitor mode process, so we deploy our policies that we want to enforce in monitoring mode. We analyse the hits and the traffic that we're getting to make sure that those policies are A, correct, and B, effective, and then we switch them on.
Right.
So we can do that again, policy by policy, so we can do that at a relatively low risk profile. And again, BAU, never ever forget about BAU. Your solutions change over time. It may be that, okay, we've got let's say a mine-grade device. 6 months later, we deploy something like an EPMA or an EPR, and now all of a sudden there's a new communication flow needed. We did have to factor that in.
Sure. So once we've done that, we've got really controlled access to the network in terms of the types of devices we're relying on. We should know what they are.
Yep.
And we should know where they're communicating as well at this point.
Yep.
Brilliant.
Absolutely.
Okay. So one left.
One left. So we've got an example here of one of the overlay controls, so in this case posture. And again, the model is very much the same. We deploy it in like an inventory monitoring mode. So with posture specifically, what we get from that is at that point we've got that bill of materials of what's on the endpoints and what they're actually doing. So one of the major benefits we see from this when we deploy it is we find persistent issues and risks that have been out there. So, let's say, for example, group policy is not working properly, therefore some of the devices don't have BitLocker enabled, for example, or some of them don't have MDE installed, or an AV agent isn't updating or whatever. And those are very good from a risk profile of identifying and capturing those devices. Obviously, that then gives us the opportunity to do something about it, and then we can transition into an enforcement mode where, when those devices are detected, we can take a response, whether that's kick them off the network in an extreme version, or perhaps just give it a reduced level of network access until the problem's resolved.
Okay, fantastic. So it's kind of a rinse and repeat process, and just back to your diagram, building the layers of trust that I'll just go through, isn't it? That's really good. So we've talked about a lot of stuff in quite a rapid pace today. Is it worth just having a bit of a recap on where we've been? Yeah,
absolutely. So I think that there's some key considerations that we see for pretty much every customer, and I think we've sort of danced around the point that stakeholder engagement really is critical to this. If you want to really get to that zero trust model, it does require buy-in. You want to get your execs on board with it. You want to get that sort of, yes, this is a journey we wish to go on, we wish to reduce our risk profile. Obviously, you talked about having different asset owners out there, getting them on board is very important. You've also got to keep in mind as well, your users, our stakeholders here, the consumption model of the network does change. So, you need to make sure that your users are aware of it and why we're doing it. Then really on the planning phase, the main advice I would give you straightforward is work out what your target state is as early as you can. So if you're going into a project where you wish to implement some of this technology, try and set out what you feel you want to get to in terms of stage to begin with. It's absolutely fine to say that our requirements and our risk appetite at the moment mean we're quite happy just to implement NAC and segmentation, and then we'll iteratively build on that with the other phases later on. That's absolutely fine. The key bit really is just to set your objectives as early as you can.
I presume we can help with that kind of approach just based on our experience and work we've done across the healthcare industry. Okay.
So really then the next bit really is just understanding your infrastructure, and what I mean by that is make sure that you understand any limitations with your existing infrastructure. Ideally map it into any refresh plans that you have. So if you've made the decision that zero trust is the future for your organisation, then just make sure that you're making sensible buying decisions to really build that capability and as you refresh iteratively through the estate. don't forget about your endpoint and identity management functions. I can't stress that enough. It is critical that you get those right. So making sure that you've got those relatively solid is pretty important, to be honest. The other bits really are just BAU and operations. So, never forget, obviously, change happens all the time.
Yeah.
New devices come along, and that quite commonly will also be existing device types that change. So if you think, every hospital will have hundreds, if not thousands, of printers out there, new models will come in periodically that you'll need to, potentially adapt to those devices. So just make sure you've got a plan for embedding this ideally into your solution selection, your procurement processes, and obviously your onboarding and your operations.
So back to the stakeholder stage, identifying your stakeholders, what your asset categories are, the types of things. Yeah, my brain instantly went to medical devices when we started talking about this. You've just mentioned printers. It's so obvious, but it wasn't the first thing I thought about.
No.
So you've got to make sure you're capturing what's on the network. And back to that kind of approach, the monitoring phase is going to help you identify that, isn't it? So if you haven't sorted within the stakeholder stage, you're going to find some information about something on the network, and you'll go and figure out, fingers crossed, who that belongs to. Fantastic.
Yeah. So I mean, that's kind of it from the considerations. Obviously, we mentioned operations there. We sort of talked about it. One thing I would say is obviously when we do implement these technologies, we do expect a little bit of an uptick in support tickets to begin with. The reason being, obviously, we're finding risk and we're resolving it typically through incidents and support tickets. So obviously, just be aware that there is a little bit of an uptick that we expect. What we generally find with most customers is it starts, not high. I think one large trust we did it with, we're getting about 15 calls a month. And then that, within a few months, that sort of dwindled back to sort of 3 or 4. So, when you think about the number of tickets most trusts get.
I was going to say we're about 120,000 a year, so 15 a month. It's not really. It's not that bad. But you're right. You've got to have the service model behind that to be able to just respond. Feed the call through the network team, or give the service desk the capability to do some of that work.
Absolutely. Yes. Just empowering the team to talk
Absolutely.
The technology.
Yeah. Okay. Lovely. There's 2 more webinars remaining in the series. So we've got Designing the Always On Healthcare Network with myself and Joseph Taverer. That's a couple of weeks' time. Looking forward to that one. And then towards the end of the month, we've got Building a Cloud-Ready Network Architecture. So it'd be really good to see people on those. And if people on the call have got colleagues who'd be interested in that, please share and let them know. If anyone's interested, wants to find out more, I suppose the first protocol is really to reach out to your account manager at Block and just have a conversation with them. If anyone wants to get in touch with me, my name is Matthew Mahoney. I'm the Director of Digital Transformation here at Block. Email address is mmahoney@block.co.uk. Drop us a line, put you in touch with the right people. Thanks very much for connecting up today. And so really appreciate your time. Hope you enjoyed the webinar, and we'll close the call.
Awesome. Thank you very much, everyone.